When COVID-19 hit our area, we were impacted fairly hard. It was scary. It was, and having her here, and then when the cases started getting here, and from my prior knowledge of other facilities in the state that were getting hit, it seemed like it spread rapidly.
We received the call that we had positive cases at 1:38 in the morning on Sunday morning, and obviously that's kind of the end of your night's sleep. It's a gut punch. You hope that never happens. That's what you're working towards, what you've been working towards for the last 2 months, 3 months. It's what you pray about every night before you go to bed, that this does not get in here. And it does. So you have one other option, and that's to come in and go to work. It was not easy. That's probably the hardest 43 days we've gone through here ever.
It was scary at first because we started off with one case, and then slowly, they just started building up. We took even more necessary precautions, and we just try to do everything for these residents. Keep them safe and happy, and just always smiling. A smile goes a long way with them.
Robert Mitchell and the staff are our heroes after this pandemic. They have all been so supportive and kept us safe.
We had days when it was difficult, and they were long days, they were hot days, they were discouraging days. There was just a lot of figuring out what to do, from our physicians to the hospitals to everything, just all our staff. So there was just a lot of figuring out, and I feel like everybody really just kept a good attitude, throughout, and very much like a sense of team and of community, and kind of we're going to get through this together.
My mom is here, and she's been here since March of 2015, and she's 91, and they have just been fantastic. Until COVID, I was here almost every day. I have no qualms that she's got the best care that she would have gotten anywhere in the world. They have just been fantastic. They've done everything humanly possible, and they kept it out for so long. Eventually it was bound to happen.
The communication with Robert and Katie, with Mitchell's nursing home to the public was excellent. They were very upfront with us from the beginning, and if it looked bad, he would tell us.
Of course, I didn't want Mother to get it, but I was never really worried because I knew they were taking the best care they possibly could of her.
This is like a second family. You come in that door with a mission to work together and just provide the ultimate care for these residents because they are your second family. I think the community helped us a lot. We had love and outpouring and praise and support from local churches. The owners, they worked right alongside us.
Robert and Katie Mitchell, they'd always, if we had any questions, we knew their door was open, so we could go in there and ask real quick. And the housekeeping supervisor, Vicki, she put up guidelines everywhere in the hallway, so we felt comfortable. We knew, and even if we didn't, there were guidelines, we could look at it.
The love that the staff has for the work that they do, I think that made a huge difference in the outcome of the COVID here at Mitchell's Nursing Home. And not only do they treat Granny like family, but they also treat us like family.
Being family owned and operated, I feel like, hey, that's what separates us from other facilities. It's a different brand. It's a little different ideology on how we operate day to day. And I think that's what a lot of people know us for and expect us to be.
I want everybody to know that the family atmosphere runs all the way through the staff from top to bottom. And it's been awesome. We couldn't have got through this without that attitude. So we're very thankful for that.
I do feel like we're getting closer to doing things on a more normal basis. Like getting to come outside, getting to attend church, getting to play dominoes. Yes, I feel like we are getting there. I definitely see the light at the end of the tunnel.
My mother is 79 today. It's her birthday, and she has Alzheimer's. So she came here in September of last year. I was having a conversation with my daughter yesterday, and I said how lucky we are that she's where she is, that she's not just a name or the person in room 104, or, she's at home, and she'll say when I would have to take her to the doctor, let's go home, and she means here.
Granny is 100. I fully believe she's going to make it to 101. She made it through COVID. to know that she's lived through so much and so many things have changed in her lifetime. And then to live through a pandemic like this, basically shut off from the world, it's reassuring.